had missing teeth, there were no permanent options to restore your smile. Today, you can walk in without teeth and go home with a mouthful ready to eat dinner. Here with the details on dental implants, please welcome back oral implantologist Dr. Farid Noie.
First, let's explain, when we say dental implants, it's like you having the most perfect teeth naturally, that even better than your own teeth could be.
Well, actually, in a way, that's true, because you end up with teeth that are titanium. That means they don't decay.
Do you have to floss them?
Well, you do have to floss. Yes, you do. But they are, for the first time, we actually have something that completely replaces a human tooth from top to bottom. Most options we've had so far have only replaced what's above the gum line, like a bridge or partial, but now
those could slip out and...
Yes, and then the bone underneath is slowly just resorb and shrinks. Now we actually have an option that replaces the whole thing and keeps the bone nice and healthy, and it keeps it from going away.
Yeah, this used to be a long, drawn-out process, but now, literally, you can get them done in a day.
I know, exactly. When I started, it was really, yes, you had to sit down and wait for a long time for the bone to heal and integrate with the implant. Nowadays, you can actually walk into the office in the morning with no teeth or bad teeth, and then leave in the afternoon with a full set of teeth and have dinner that night.
Yeah, you actually have patients who will know exactly where they're going to eat dinner that night.
Exactly. They have it planned. I'm telling them, well, maybe you just want to have a little something simple.
Yeah.
But yes, but you can actually go and have yourself a nice dinner.
Yeah, a T-bone.
T-bone.
Okay, so what patients should expect is, number one, we got to figure out who qualifies for dental implants.
Absolutely. So what we basically do in the first appointment, we actually we go over the patient's medical and dental history thoroughly. Look at all of their, what's going on with their health. We examine their oral maxillofacial completely, take CT scans and review all the scans. And if the patient has any kind of existing condition, we will consult with their other doctors to make sure they're all on board. And
because you work to clear up any problems.
Absolutely, to make sure that there will be at any time, patient will end up, God forbid, have any be harmed because of the miscommunication.
Right.
So. Then actually what I usually like to do when we have a CT open, actually I have a 3D image of their mouth and their skeleton, their jaw. And I will do the procedure virtually on the computer in front of them. So you can
so it's
know what they're going.
custom made to fit your mouth, the color, the shape, everything.
Exactly.
There are lots of folks out there who are, I say lots of, not really lots of folks, but there are several people out there doing this.
Yes.
And the point you want to make is that you need to interview your doctor. This is a big surgery. You need to interview the doctor, and there are several questions you need to ask. One is, for example, we'll ask with you, so how many dental implants have you placed? Is it one, more than 10, more than 100, more than 500, or more than 1,000? The answer is?
Yes. Well, in my case, I've done definitely more than 1,000, so that's well within the 4 zone, yes.
So you've got some experience there.
Yeah, so yes, exactly. You like to make sure that your surgeon has done this before, and experience is something that just comes only with experience. You cannot, no amount of education by itself can replace the experience.
Right.
When you do something, you get good at it, and the more you do, the odds are you're doing better.
So when your doctor says, well, I just graduated yesterday, but I'll give it a try, then you probably should think differently than that. Okay, the next question is, how many dental implants have you placed this year, so like recently?
Exactly. Do you also want to make sure that the doctor has done this, is still doing it, it's not something that they did in the past, and now they're getting back into, are you current and up to date with what's going on today?
Right, because even the technology can change.
Absolutely.
You've done more than 500 this year alone.
Absolutely, yes.
Okay, what is his or her failure rate, which is something important to know? It's a lot that you may have put in, but what is the failure rate? And so is it 5% or less, less than 4%, less than 3%, less than 2%, and for you it's less than 2%?
Mine is less than 2%, yes, but also you're absolutely right. You want to, if you do this for real, you need to keep track of all your failure rate. You see what you do, and you have to understand where you're failing and what is it you're failing on. So if a doctor doesn't know his failure ratio, that probably is not a good sign.
Right, because you need to know what's not working so that you can even put it into a pool of research so you know what can work better for particular patients.
How to do better, actually, how to learn from them.
All right. Do you offer deep IV sedation? Is it no or yes? The answer for you is yes. Night, night, and wake up with a mouthful of teeth.
Yes, we do basically, you like to remember, or do you just like to not remember, just go to sleep and wake up magically and it's over?
Yeah. Okay. Also, will the same doctor who surgically places the implant also restore them? And the answer for you is?
Yes, and I believe that's also a plus because it's good to have a continuity. If you start from scratch and you finish, you probably have a better idea of where you're going with this and have a much better, transition.
Yeah.
As opposed to going through different hands.
And that constant communication with your patient. You add up the score and you rate your dental surgeon. But important to know what the experience is so when you go night-night, you feel more comfortable about doing that.
That's right. That is so
All right. Well, Dr. Noie, thank you very much. I know several people have gotten dental implants, and it just completely changed their life.
It really does. Yes. Thank you so much. Thank you.
All right. For more on Dr. Noie and his services, you can call this number, 281-332-4700, 281-332-4700, or log on to drnoie.com. That's drnoie.com. And have those teeth in ready for all the holiday meals that are to come. Well, many of you have